Hey there, my name is Megan Clanahan. I'm the co-owner of Houston Moms. I am so excited to be with you today. This is our first video of 2022 with UTMB Health. If you watched any of these last year, you know that every month we brought you a really important health topic, things that you as parents and as moms want to know about, and we're diving in deep. And we listened to what you had to say as well. And you loved when we brought patients on to share their specific testimony as to their experiences. And that's what you related to. So we're going to do more of that this year going forward, starting with today. And today we are talking all about OBGYN health and how to choose your OBGYN provider, things you should consider when choosing an OBGYN. And then we're going to talk to a patient about her particular experience with UTMB Health. As a reminder, UTMB Health is our preferred provider for the Clear Lake, Friendswood, Bay City area in Southeast Texas. And so we are thrilled to have a big panel for y'all today. And so over here, and I'm not sure what direction she'll be in, I have Dr. Joyce Muruthi. She is board eligible OBGYN, and she is out of the Friendswood office. And then we have Dr. Kimberly Robinson, and she is a board certified OBGYN and is out of Webster and Clear Lake. And below me, we have Taylor Thurstonson. I knew I was going to get stuck on that. Thurstonson, and she is a patient, and she was a patient of Dr. Maruthi's. There was an experience, and so she got to be a patient of Dr. Robinson's. And so we're going to speak to all of that as we go forward. So thank you all three for being here with us.
Thank you.
Awesome. Well, let's start with you, Dr. Maruthy. You know, there are a lot of OBGYNs in this city, and there are a lot of mamas. Can you speak to what we should be looking for in an OBGYN healthcare provider?
Sure. So there are a few things that I think patients often come looking for. There are some patients who are really interested in seeing female providers specifically, so kind of judging where your comfort level is. In terms of the services that are provided, you know, if you're looking for an OBGYN that's going to be able to do your GYN surgeries, most practices, you know, most doctors will do both OB and GYN, but there are some practices that do more GYN or more OB. Kind of, I think the best way to do it is to, you know, go and see whether you have a good fit with your provider. Being comfortable is really important in an OBGYN office. Do you feel like you can trust your provider? Do you have a good rapport with your provider? And obviously, you know, are they providing the services that you're looking for at that time?
So just to kind of break it down simply, when we speak to OB, we're talking about babies and all of that, correct?
Correct. So the OB side is obstetrics, that's the prenatal care, delivery, postpartum care. And then the GYN side is the heavy bleeding, birth control, family planning, that side of medicine.
And the people like me who might be done with babies, right?
Yes.
Yes. Okay. So for people who are not like me and are on the OB side, obstetrician side, we need to be looking at where we want to deliver. What does a hospital setting look like? What are the things we should consider there? Dr. Robinson, can you speak a little to that?
Yeah, so, you know, I think one of the biggest thing when it comes to the hospital and delivery, you know, for sure, making sure that your physician group delivers there, because, you know, that happens more often than you would know, that people end up in the wrong location. So the biggest thing is making sure that you discuss which our delivery facility is the UTMB Clear Lake campus on Webster, on Highway 3 is on Blossom Street. And so the biggest thing is just making sure you know the location where your doctor delivers, because not all doctors are attached to all the hospitals. So that's the first thing. And there are a few hospitals in the area. So just, you know, making sure you know where your doctor is delivering. The second thing is just making sure, you know, I think the biggest thing with delivery and hospitals, the hospital is definitely important, but knowing the group, right? So you're in a good group of doctors. And so, the doctor is a very big part of the process, along with the patient and the nursing staff. So trusting your physician is one of the other key things that you need to know, because if you trust your physician and their partners, then you know that they're going to do what they have to do regardless of what is or isn't available to take care of you. And so that's another thing that I would say. In terms of the facilities, just making sure that they have great nursing staff, the anesthesia's in-house, which is the case at UTMB Clear Lake campus. And then the nurses are very well trained there as well. So just having a hospital with multiple services, which we do, making sure there's an ICU, making sure that there's a nursery to care for babies. All these are good things that patients need to consider. And we have all those things available, and making sure that there are, pediatricians and neonatologists available, and high-risk doctors, on standby that we can consult with if we need to, if a high-risk situation develops. So those are things that you need to consider. And again, we have all of those things available for the help and care of our patients in labor and delivery.
So that's something that we never want to think about is, what if things don't go exactly according to your birth plan? I mean, we all have this idea when we get pregnant that it's going to be this, this, this. And I think it very rarely follows this, this, and this. In the times of COVID, obviously we have another wave coming through. What does that look like right now for UTMB Health? Are y'all doing hospital tours? How do you recommend that people check out practices as well as hospitals?
So this has been very difficult for everybody, and it's very difficult for us as well. For a little bit there, a lot of us were meeting dads for the first time in the delivery room, and it's just very different from what we're used to, because we're used to meeting a few family members by the time we got to the other side of delivery, and to be meeting dad for the first time in labor and delivery was difficult. But now, fortunately, things are, definitely not resolved from a COVID standpoint, but a little better enough to where we're able to at least allow one visitor into the clinic, as long as the patient and the visitor don't have COVID symptoms, all right, or not positive for COVID. In the hospital, the current policy, it changes a little bit, because, quite frequently based on the numbers. But right now we're, back to 2 visitors in labor and delivery, which is awesome. So, your 2 support people is great, unless you have COVID with, symptoms that changes things a little bit, unfortunately, just so that we can keep everyone protected. And so that's where we are. In terms of tours, we're not back to in-person tours yet, but there is a virtual tour online that you can do. So that is what we have available currently. I hope that the numbers and COVID and all the things go away really soon, so we can get back to some sense of normalcy, because, it was nice, and you do forget that those things that were fun, or got to see, the patients and their spouses walking through labor and delivery and seeing them, see the rooms. I mean, those little things are lights in our lives that we don't get to see right now. And so, I think it'll be awesome when we're able to do that again.
So we will drop that link below at the virtual tour, because I think now we've all become pretty accustomed to virtual tours and what that looks like. So we will make sure to put that below. Dr. Muruthi, kind of talking to high risk and having knowing what kind of NICU level services are available. Can you speak a little bit to why we should all have that in the back of our mind? And that's going to kind of play into Taylor's story here.
Sure. I think knowing, the NICU designation level is kind of complicated, and even for those of us in medicine, because different levels mean different things. But I think it's important because, like you mentioned earlier, labor and delivery is a really unpredictable place, and we always, of course, want good outcomes and anticipate good outcomes, but things change so rapidly during a pregnancy, as Taylor can attest to, that it's important to know what kind of care can be delivered at the hospital you're at. So there are different levels of NICU. For instance, here at Clear Lake, we do have a delivery limit of 35 weeks, and that's a function of what we're able to take care of on the pediatric side. And Galveston is a different level NICU. So that's a discussion to have with your obstetrician during pregnancy, specific to you. What is your risk of pregnancy and what are you able to do at the facility that you're at? And that's certainly also a discussion you can have with your pediatrician if you meet your pediatrician before delivery, and the NICU team, so that everybody can be on the same page in terms of, if there is an anticipated complication, this is what we're able to provide here, but this is what we're able to provide in Galveston. So it's just a constant communication between you and your obstetrician about your specific risk level.
Perfect. And so Taylor, this was sort of your story. And it sounds like it was a bit unexpected. Can you share a little bit about your journey, kind of how you landed at UTMB, and then what has happened with your most recent baby, which we should preface, 6 months old, it's a boy, Colt, and he's doing great, right?
Yes, he's doing wonderful. He's a mama's boy. He's doing great.
So we'll just, get that out of the way so nobody's sitting on edge here. So a little bit of your story, Taylor.
So I won't go too into my first pregnancy, but my first pregnancy, I delivered at 28 weeks, and my daughter was also a ruptured placenta as well. So thank God, with this pregnancy, everything was looking fine. I had something called a 2-vessel cord with my son. So that wasn't necessarily anything crazy. That can be pretty normal. We were just doing pretty frequent ultrasounds. And in fact, the day before I delivered, I had an ultrasound and he was growing great. Everything was going well. So I had gone into work on Saturday. I used to be an ER nurse at UTMB in Galveston, and I just felt off. I didn't feel right. I was really tired. The last 2 weeks before I delivered, my heart rate was shooting up in like the 130s, 140s. So we were just trying to take it very easy. And I just ended up going home, and later on in the afternoon, I started kind of feeling crampy, but I know that can be normal during pregnancy, so I didn't think anything about it. And then I started to bleed, which was very reminiscent of my first pregnancy. And so I kind of started to get a little concerned. My husband was very concerned, but sometimes men can be a little dramatic. So I was like, no, it's okay. I know what to do. I'm going to lie on my side. I'm going to drink some water. Like, it will be okay. Like, everything's going to be just fine. And then about 10 minutes later, I actually started hemorrhaging out again, just like my first pregnancy. So one thing that's important, at least for me, when I look at an OB-GYN in the hospital is, unfortunately, it has to be close to my house. So thankfully, UTMB Clear Lake is only about 10 minutes away. When I got to the hospital, I think they said I was dilated to about an 8 or 9 at that time already. My water never broke. I was just hemorrhaging from my placenta. So it was a little bit unexpected. It was definitely crazy, even being a nurse, because in my head, I kept thinking, I just had an ultrasound yesterday, like everything was fine. This wasn't supposed to happen. In fact, I said that in the delivery room, this is not supposed to happen. But UTMB, I can't say enough great things about them. They were quick, they were fast. You can tell that this team works together all the time. It was actually incredible, especially coming from an ER standpoint, because I saw that as a nurse and I would see that every day, but to see that as a patient is actually truly amazing, to see such a cohesive unit, especially in an emergency like that. I ended up getting an epidural. Thank God. I probably shouldn't have gotten an epidural, but y'all are amazing. I got an epidural. And we ended up having to do an emergency C-section because my son's heart rate dropped and his oxygen, I think, got to like 60%. So, and I believe, Dr. Robinson, you can correct me on this, I was her fastest C-section. I think from what you said, from the labor room to cut was 3 minutes. So it was
very fast. They were on target for sure that day. I'm very grateful that everybody was together and got you back there really quickly.
I cannot say enough about everything going on, and even being a nurse, I kind of felt dumb. I knew it was coming, and I knew labor was imminent at that point. And I still was like, "Where's Dr. Muruthi?" And they're like, "We don't have time to call her in. Like, you're not having her deliver you." But Dr. Robinson was amazing. Both of them actually checked on me the next day. The head anesthesiologist who did my epidural checked on me the next day. I mean, I got absolutely incredible care. And Megan, kind of like you said, you can plan everything out, but with OB, your baby's going to come when they want to come and how they're going to come. So to me, it was just amazing because I didn't have my doctor that I had been comfortable with and who knew me and who knew my pregnancy, but I felt just as comfortable with Dr. Robinson. The nursing staff was great, anesthesia. I mean, for how bad things could have been, I can't just say enough about the staff there. It was great.
See, and like I'm gonna get teary as a mom. I think that is we are very protective isn't the right word. We are very emotionally connected with our OBGYNs who are walking this
Absolutely.
journey with us. And so I can only imagine that day for you. And you're like, but Muruthi is supposed to be here.
Call her in.
I just saw her. And I do want to clarify before we logged on and started recording, y'all, it was like a reunion on here because these three do have a very special relationship. Dr. Muruthi, who carried Taylor through her pregnancy, and Dr. Robinson, who was able to come in and safely get Colt here. And Dr. Muruthi, can you speak a little to, I mean, what does it feel like when you hear about a patient like Taylor, and that was your patient, and I'm sure you were concerned about her too. What does that look like in the trust that you have in your other providers?
I think it's great. We have a great group here, and there's a lot of comfort in knowing that we can't, as human beings, be on call 24/7, 7 days a week. We're physicians, but we also have lives of our own. And so to know that you have, as doctors, as OBs, we invest so much in our patients, and there is a very special bond that comes with helping somebody, through a pregnancy, from that first ultrasound to anything that comes up. So to know that whether I'm here or it's any of my partners that are here, my patients are going to get excellent care, helps me sleep at night. I'm sure Dr. Robinson feels the same way. And it helps us be honest when we tell our patients, if I'm not there, one of my partners is always there, and they're all great. It's a really good feeling to be able to be a part of a group that has that same mentality and that same level of support.
And Taylor, was that something you thought about when you were, looking into choosing a healthcare provider? Obviously you had kind of referenced an early term pregnancy before. So was that something that was in your back of your mind?
Honestly, not really, because thankfully so far everything had gone perfect with this pregnancy. But I did tell Dr. Muruthi that for whatever reason, I had a bad feeling that I was going to deliver early this time. And both her and my mom were like, "No, you'll be fine." But I did. I had a really bad feeling that I was going to deliver early again. I will not have any kids. And I think, definitely as moms, you don't want to think the worst. Mm-hmm. But I think if you are prepared for the worst, and if you are prepared for that, you'll be prepared for anything in between. So for me as a mom, definitely looking at your provider, but also looking at the other doctors in the office. Do they come highly recommended? For me, I wanted a female OB-GYN. I know some people are comfortable with males, but my personal preference is a female. So I think also just looking at the other doctors in the office too, just so you're kind of aware of, what happens in case of an emergency. And hopefully that doesn't happen, but sometimes babies decide to come earlier or sooner or in another way than we expect.
Mm-hmm. So Dr. Robinson, is there anything that you would like to add? For the mom out there who is thinking about getting pregnant, or maybe they are pregnant and not exactly satisfied with their care, or just wondering what else is out there. How would you speak to those parents out there?
What I would say to that ultimately is, you have to be comfortable with your doctor. I mean, that is the number one essential thing. You have to be comfortable with the group. I always tell my patients, and I say this, wholeheartedly, that I trust all of the doctors in my practice with, I delivered a UTMB for all 3 of my pregnancies. Dr. Alvarez delivered my twins. My 2 other babies were BOIs because I'm from Galveston. And so, they were born down there. And so you have to trust the healthcare system and you have to trust the doctors. And, sometimes, if you feel like you're not getting a good response or you're not, fostering a good relationship with an OBGYN, that is okay. Because as much as, we want you to be our patient, we want you to be our patient under good prefaces. So if you are feeling like this is just not working, that is okay, because we want you to get the best care that you can. And the best way that you do that is find someone that you're comfortable with. I mean, there is occasion, not often, patients see me and then, they go and see someone else and they feel more comfortable with them. And I'm okay with that, because the whole goal is to make sure that mom is happy. And if mom is happy, then she feels better able to express her concerns to the OBGYNs to have a better pregnancy and better outcomes. And so, as a doctor, right, we take an oath to do right by the patient. And for us to do right by the patient, it doesn't always necessarily mean that I'm the best person for you. I may not be, and that's okay. I just want to make sure, and all of us, I think, will attest to that you are getting the care that you feel that you need. And so that is what I would say to that. Find a person that you feel you connect with, find the group that you feel like has a good cohesive group, which we do, and, go with that. And if that doesn't work for you and you feel like it's not a good fit, it's okay. If you need to look around and get a second opinion for a different doctor, that's okay as well.
I think that's such an important point. And also, I caught the fact that you're a twin mama. So am I. So, hey, twin moms. Which puts us in a whole different club, which we probably at some point need to do a multiples OB gen discussion. But
yeah, I'll come back and we can talk about it, because I've seen both sides. I have seen the twins.
That opens up a whole high risk thing. And I loved how you want to be, obviously, you want the best outcome for your patient, and whether that's you or somebody else. And I think it's really important for moms, and Taylor would probably attest to this, that we need to advocate for ourselves. And if we don't feel particularly comfortable with the doctor, we get one shot at this particular baby, and,
Right.
and it's the time for us to be able to stand up and fight for what we think is right. Taylor, would you agree?
Oh, absolutely. And I think my relationship with both of these doctors is honestly what carried me through my pregnancy and what carried me through my delivery. I mean, these people are going to be with you through the not worst time, but one of the most traumatic, whether you have a good delivery or bad delivery. This is the hardest part of being a mom, I feel like, is delivering your kid. And so that relationship is so important. And again, I am so thankful that I have both these doctors, and I think they're always going to be a part of my life no matter what. Now we're kind of bonded.
And now you're taped forever. So,
Forever.
so you have that too. Dr. Muruthi, any closing thoughts?
I think, just to echo what Dr. Robinson said, any patient-doctor relationship is just that. It's a relationship. And I always try to remind my patients, I'm not here to necessarily tell you what to do. That's kind of the old school model of medicine.
Right.
It's more of a collaboration. You come to me, with a question, or we're taking care of your pregnancy. I give you the benefit of my knowledge, and together we make a decision that's best for you, because not every decision is going to be the same for every patient. So if you're with a physician or at a practice where you feel like you're not being heard, you're, being overlooked, you're being diminished, then find a doctor and find a group that will listen to you and take care of you in a collaborative way, so that you're receiving the best care. Because ultimately, we're here to do right by our patients.
I love that. And I think that's what I love so much about UTMB Health is y'all truly do have this collaborative care system down, from from OBGYN to the hospital that you deliver at, to having pediatricians there that are available when you deliver your
Absolutely.
babies, and all the things that come after that. Y'all are truly there. So I love that so much. Taylor, I'm so thankful that you shared your story with us today. And I know sometimes it's really hard to kind of open yourself up, but I appreciate your vulnerability, and so glad Colt is doing amazing. And maybe we'll have him on in like in a year or so and see little Colt. Dr. Muruthi, thank you again for joining us for the second time. It was so good to see you. Dr. Robinson, very, very nice to meet you. We are going to drop the links below for everything as it regards to UTMB Health and OBGYN services, how you can find a provider. We will put that in the comments below, as well as that virtual hospital tour. I know that's going to be really important for some of you expectant mamas out there who want to see what it looks like before you walk into the delivery room. So we will put all of that pertinent information for you. Again, we thank UTMB Health for being our preferred provider for the Southeast Texas area. And we will see you again next month for another timely health relevant video. Take care, and we'll see you soon.